Beneath the surface of the COVID pandemic bubbles a long-term health challenge. Some have called long COVID a silent pandemic. One paper has estimated a fifth of people will have COVID symptoms for at least a month, and women are twice as likely to suffer long-term symptoms. Hello, this is The Virus. I'm Casey Briggs. This week, who's getting long COVID? How does it affect them? And can it be treated? But first, let's take a look at the latest figures from Australia. And it looks like we're entering our fourth upswing in cases this year. There are, on average, more than 30,000 case detections a day. And the trend is upward in most states and territories. And the number of people in hospital with COVID-19 is also climbing again. More than 3,000 people are admitted. It's still quite a ways short of the January peak, but it is growing. The ACT currently has more people in hospital with COVID than it ever has before, after a spike in admissions this week. Although there are still only one or two people so ill that they're in intensive care. That's the red along the bottom of this chart. Deaths with COVID have been above 40 a day for a month and a half now. The daily death numbers are very slowly growing. We're seeing about 48 across the country every day. So Australia is still recording higher mortality than it would have without the pandemic. Of course, most people who get COVID won't die, but some of those newly infected people are going to have health issues for a long time. And women may be around 50% more likely to develop long COVID. That's the finding of researchers at King's College London, who reviewed data from nearly 7,000 people in health surveys, as well as the electronic health records of more than 1.1 million people diagnosed with COVID-19. For more, let's bring in the ABC's medical reporter Sophie Scott now. Hi, Sophie. There's still a lot we don't know about long COVID. Maybe should we start with the question, is there a clinically agreed definition of what it actually is?
So it really is a condition where people don't get better after about 4 weeks of having COVID, and it can be a multitude of symptoms. And it can range from things like dizziness, severe fatigue, cognitive dysfunction, breathlessness, things like depression and mental health issues. But it really is a spectrum of illness. And so what happens, it became pretty clear pretty early into the pandemic that not everyone was getting better straight after having COVID. And that's when people started to see what they now call long COVID. And even though you can have long COVID even if it's only a couple of weeks after having the infection, but people are still having long COVID for months and months and months after being infected. And the reason they think it's going on for so long is that they think that the virus can actually sort of lurk in different organs in the body. It can sort of lurk in the lungs and the heart and in the blood vessels and cause problems and cause inflammation and cause problems with the immune system as well.
Can you tell us a bit more about this latest research that's been published? Who's most at risk of developing long COVID?
So this study really backs up what other studies have found, and that it's more likely to be women. It's more likely to be people who are older. So they found people in their 50s and 60s were the most likely to get it. Interestingly, when you got to sort of 70 plus, the rate of long COVID decreased. But they found women in their 50s and 60s were more likely to get it. You were more likely to get it if you had poorer health before the pandemic, and particularly if you had asthma. That was definitely a red flag to go on to get long COVID. And then you had poorer sort of general health before the pandemic and before you got COVID. But there are long COVID clinics that have been set up in hospitals across Australia, and they're about to be set up in regional parts of states like New South Wales as well. And so we're going to need to see much more research and money and focus put towards treating these illnesses, because for a lot of people, they can't work the way they used to. And it has been called a mass disabling event, as you mentioned it, as the silent pandemic. So we really need to see the focus on this, and to, even though in some ways we're going back to some sense of normality for a lot of people, they're not going back to normal because they've been left with long COVID, and we need to make sure that they're looked after.
Medical reporter Sophie Scott. Well, as we've heard, there are a wide range of experiences being reported by long COVID patients. Let's hear one of them now. Belinda Dendel is a teacher from Central Queensland. The mother of two contracted COVID in February. she's still feeling symptoms. She joins us from Springsure, that's 4 hours west of Rockhampton. Belinda, thanks for joining us and thanks for sharing your story. Let's maybe start with the initial COVID diagnosis and the initial period with COVID. How badly were you affected?
The first few days were just simply a typical COVID sort of feeling, sore throat, very unwell, just relatively crook. But then about 3 or 4 days in, I had really severe heart palpitations and a breathlessness and an overwhelming feeling that I wasn't going to be able to keep breathing. Like it was quite alarming. Living where we are, there wasn't much of a conversation about COVID being that seriously affecting. Everyone had sort of just either not had it or just small symptoms. So I rang 13 Health and just told them what I was experiencing, and they said get to the hospital. But of course, going to the hospital wasn't too easy because they didn't really want me at that stage being COVID positive. So I had a wonderful nurse who dropped in a little oximeter to watch my oxygen, and then I had a GP ring me every day to check on my condition.
So I guess, Belinda, you've had, not the greatest COVID experience in the first place. It's been difficult getting medical help, but then it's just stretched on and on and on and on. What have the last few months been like?
Oh, a roller coaster. Because it took over almost 3 months to diagnose that I actually had damage to the outer lining of my heart. So pericarditis has been diagnosed as being the inflammation, and that's how obviously it's affected me. It's made me incredibly weak. I'm relatively fit and active. We have animals and a farm, so I was somebody who was active, and I went from that to walking like an 80-year-old woman. That's how I felt. I was so weak, and sleeping, I would wonder whether I'd wake up in the morning with the pressure on my heart. It was like a horse's hoof was pushing down on my chest. And so then I'd have a few days where I wouldn't feel too bad. So I'd think, oh, beauty, because there's no roadmap with this. There's no expiry date. You don't know what is going to happen to you. So I would feel okay, and then I would hit rock bottom again. So it would be up and down for months. Yeah.
You said there's no roadmap. I guess not knowing if and when these symptoms will clear up is a bit of a drain. How are you feeling, today about this experience?
Fortunately, I'm receiving treatment now for my pericarditis, and I'm actually starting to feel like I can see the end of the tunnel, which for a long time I couldn't. I would take months of looking. I'd have to go back and look back weeks to actually see any change or any improvement. It was just so minimal, and it felt like I was plateauing often. If I wasn't feeling good one day, I was in bed for a week the next. So mentally it was very draining, and I had to just ride it out, I suppose, and rest was all I could do for months. Yeah.
Thank you so much for sharing your story with us today on the virus.
Thank you.
Well, in Australia, researchers at the Kirby Institute have been following up long COVID patients at regular intervals since April 2020. So basically the entire pandemic. Professor Gail Matthews is leading that study. She joins us now. Thanks for your time, Professor Matthews. It seems there's quite a spread of the kinds of symptoms that a long COVID patient might experience, from a lingering cough to much more serious impacts on their life. Is there such a thing as a typical long COVID patient?
There's no such thing as a typical patient, but there are certain patterns of presentations, I think, that we tend to see. So Certainly, we have patients who have long COVID who've been very sick in the hospital with a pneumonia on intensive care, for example, being ventilated. And they have a long COVID syndrome, if you like, which relates to their very significant illness and lung disease. We have other people, however, who have a much more milder initial illness and who present with a different type of presentation that's much more centered around fatigue, brain fog, and some sort of more myalgic type symptoms, more akin to a sort of chronic fatigue type presentation. And then we have other patients who present more with a cardiac presentation with palpitations, heart racing, dizziness, a syndrome akin to something called POTS, which we also have seen before COVID. So there's no typical patient, but patients do tend to fall broadly into certain presentations.
In what kinds of numbers are we seeing long COVID patients in Australia?
Well, I think that's a very good question. I don't think anybody has a real true sense of how many numbers of long COVID patients there are, because it very much depends on how you define long COVID, how you ask the question, who you ask the question to, etc. In our initial study, then this was done before vaccination was widely available, we found about 30% of our patients that we started following up after their initial COVID were still symptomatic at about 3 or 4 months. That is probably less now. The data does vary. I would suggest it's somewhere around the 5% mark, something like that.
We've heard a lot of stories about individual patients who have suffered for weeks, months, perhaps even longer. You've been checking up on patients for more than 2 years now. Is this a chronic condition for some people? Is this lasting for not just months, but maybe years?
I think we don't know the answer to that question yet. So you're right. We're just completing our 2-year follow-up. So we started following people in around April 2020. So those group of people are sort of finishing their 2-year follow-ups now, and we have to look at the data. And then obviously we'll report on what we find. Anecdotally, we still have patients obviously who are symptomatic, certainly from a sort of lab-based perspective. We looked at patients at 8 months after initial infection and found very elevated levels of activation in their immune systems at that time point. So very hard evidence, rather than just asking people as well whether they'd recovered, very hard evidence at that many month time point after infection that there was something still abnormal, and we'll be repeating those laboratory-based studies as well as surveying our group of patients in the coming months.
How do you treat someone with long COVID? What's our understanding of the best way to offer medical support for someone that's still seeing these symptoms for months?
Well, I think it clearly depends on what's going on. And as I said, there's a number of different reasons why people can have long COVID. So mostly, firstly, I would say that the assessment of somebody with long COVID needs to be multidisciplinary. So it needs to involve multiple different angles of assessment. It needs to be personalised to that particular patient in terms of what symptoms they have and are presenting with. In general, our rule of thumb is to work through any coexistent pathologies that may be present that we can treat, for example, clots or heart disease or something else that's there that we can treat that maybe they're coincidentally or may have been caused by COVID. So do a really thorough assessment. And then after that, it's around often managing symptoms at the moment. And what is very clear is that unfortunately we do not have a single therapeutic, as in a drug, treatment for long COVID.
There's a lot we don't know, Professor Gail Matthews. Just briefly, what's the kind of most important question about long COVID that you'd like to get an answer to?
I think that the best thing for us to understand would be what it is, or if there is anything we can do in the setting of acute infection to limit the number of people who go on to develop long COVID. Firstly, because COVID is going to be with us for some period of time. So we need to prevent future long COVID cases where we can, and maybe that is with more antiviral usage. We don't know the answer to that question yet. And then, of course, we need to have much more data on exactly who is suffering from long COVID in the Australian population and therefore how we can help them.
Thanks so much for your time.
Thanks.
And that is the show for this week. Thanks so much for your company. Bye for now.